So my first step would be to review the patient's MAR. Then I would gather the correct supplies, which would be a 22 gauge, the bandage or tape to go over, extra 2x2s, alcohol pads, tape, a tourniquet, a saline flush, and the extension line. Then I would knock and enter the patient's room. I would perform hand hygiene, provide privacy, and introduce myself. Hello, my name is Ella, and I'm going to be your student nurse for today. Then I would identify the patient, their first and last name and date of birth, and ask if they have any known allergies. Then I would explain the procedure that I'm doing today. So it would be a little along the lines of, today we're going to be entering an IV into your vein. This will help us give you fluids and medication. Then I am going to connect the IV or the extension port to the saline flush. First, I would use an alcohol swab to cleanse it, and then I would connect the flush to the line, and then I would inject the saline into it to ensure there's no air bubbles. Then I would set that off to the side. Then I would raise the bed to a working height. Then I would identify where I'm going to place the IV. Once I have found that, then I'm going to apply the tourniquet right on the arm. Using the quick release method, leaving that on for no more than 2 minutes. Once I have that on, I'm going to perform hand hygiene and then apply gloves. Alright, once I have my gloves on, then I am going to disinfect the area using a side-to-side motion over where I'm going to inject. Once I let that dry, not using my hand over it like this, once I let that dry, I will be able to insert the IV. So then I can get it ready. Once I have it ready, I'm going to prepare it with the bevel up, pulling down on the skin and then injecting it at a 30-degree angle. Once I insert and there's drawback, I'm going to flush over it with the skin and then only inject the catheter. Once I have that, I'm going to pinch it off about 1 to 2 above, and then connect the port like this, and then I'm going to flush. So unfortunately, I can't flush for whatever reason.
Is it in the vein?
Yeah, it's in the vein. I saw drawback. So for whatever reason, I can't flush it, but there's my proof that there was, or that it was in there. Right. So anyways, after that, I can disconnect the saline, and then here, as I'm still stabilizing it, I could ask the patient to hold it as well. I can apply the dressing. Okay. Making sure I'm not going over the hub of the catheter. Like that. like so, and then I can discard of any supplies that I don't need anymore. Then I can remove the tourniquet. Forgot to do that. Then I can take off my gloves and perform hand hygiene. Then I would label it with my name, date, and time. And then after that's done, then I would disregard of all of my stuff, and then I would see if the patient needs anything else. Right. And then after that, when I'm taking it off, I would gather my correct supplies. So it would be gauze pads and then tape. And then I would identify the patient with their first and last name and date of birth, do K-wipes again. After that, I would perform hand hygiene and then apply new gloves, which might be a little difficult. My hands are a little sweaty. Anyways, then I would put gloves on. Okay. After my gloves are on, then I would start removing the tape, making sure that the catheter is holding steady so I'm not pulling on it at all either. Alright, once I have the tape off, I'm going to hold the gauze over the site, and then when I'm ready, I'm going to pull it in line with the vein. Then I'm going to apply pressure for 2 to 3 minutes over the vein, like I am doing. During this time, I would tell the patient that if they notice any redness or irritability or swelling around the vein, to let the nurse know. And then during this part, I'm also going to look at the catheter to make sure that the tip is intact. If it's not intact, I would tell the charge nurse or the provider. After that time is up, I'm going to get a new piece of gauze, replace it with the old one. During this time, I can ask the patient to hold that piece of gauze there as I get the tape ready. And I can apply the tape like this. And then discard of any of the supplies that I have used in the proper containers. I can take my gloves off and perform hand hygiene, document what I need to as well, and then I would leave the bed low, locked, and the call light within reach, and then I would ask the patient if they have anything else that they need. Okay, so here's me and Paige's debrief.
Okay. I think you did a really good job, actually.
Thank you.
Did a good job of explaining everything. I like that you cleaned the extension tubing before attaching the saline. Just verbalize wiping the site for 30 seconds. And then one thing, remove the tourniquet before attaching the saline. And then when you're taking it out, make sure to clamp the infusion tubing before.
Okay.
But other than that, you did a very good job.
Okay.
Yeah.
Thank you.